lung cancer has been diagnosed only after people have noticed symptoms of the disease, such as a chronic cough, wheezing, chest pains, and/or the coughing up of blood. Lung cancer is the #1 cancer killer in Canada. Lung cancer is a disease in which abnormal or cancerous cells grow in the lung. The cancerous cells replace and destroy healthy tissue. What the early lung cancer screening study is hoping to achieve with the use of CT scans is the ability to diagnose the disease at a much earlier stage, which would result in a higher cure rate. To be eligible for the study, one must be 50 years or older. Originally, participants were 55 or older. A current or former smoker of at least 1 pack per day for 10 years. No prior cancer of any types except non-melanotic skin cancer, and be in good health.
Well, Cathy was one of the earliest participants in the study. So what usually happens that participants, volunteers, they do get the so-called baseline study, and if you find something that's worrisome, something that doesn't really belong in the lung, mostly we decide to follow it up, either after 1 month or 3 months, depending on the scenario, and see whether it has changed.
I was called quickly and told that there was something. They weren't sure whether it was perhaps infection or whatever, but there was something, and they wanted me to go on antibiotics for a month to see if that disappeared. So I did that.
We did follow her nodule up after a month, and it hadn't changed. And then we decided to biopsy, just to get some cells out of this tissue and see, is it actually something malignant, or is it, something else?
A lung needle biopsy uses the image off a CT scanner as a guide. A fine needle is inserted into the lung. The needle collects a small bit of tissue which is later tested for cancerous cells.
Her biopsy actually was done in the beginning of May last year, and so I met her at the day of the biopsy, and then she was already worried because it's already an intervention that had to be done, because she, like almost everybody else who's participating in my study, people are worried. They know they do smoke or did smoke and do feel guilty about it, but they do participate in the study because they want to be reassured that they do not have lung cancer. And it works 98 out of 100 times that they end up not having lung cancer, but it's about 2%, so 2 out of 100 participants that end up having lung cancer that we do find in a much earlier stage than they would have found otherwise.
I did not feel prepared. I was going in for another chest x-ray, which was a follow-up to the biopsy that day anyway. So I didn't suspect, I thought I was there for a chest x-ray. However, Heidi took that opportunity to make sure I was there and she would tell me. And as we were walking down a very long maze to get to her office, and no one was talking very much, it was Maureen McGregor and Heidi and I thought, this has a little aura about it. So I suspected then that there might be bad news.
This year, an estimated 22,200 Canadians will be diagnosed with lung cancer, and 19,000 will die because of it. More Canadians will die of lung cancer than breast, prostate, and colon cancers combined. On May 4th, 2004, almost 2 months after Cathy's initial phone call to the early lung cancer screening study, she prepared herself for what she was about to hear. In March 2004, Cathy Kernahan, a successful businesswoman and mother of 2, became a participant in the early lung cancer screening study being conducted at UHN's Princess Margaret Hospital. As a 60-year-old former smoker, Cathy thought it would be to her benefit to partake in the study, believing all the while that nothing would be found. She underwent a CT scan, which is the main component of the study. When a nodule was discovered, Cathy was given antibiotics to see if that would clear up the spot. A month later, there was no change, so Dr. Heidi Roberts decided a needle lung biopsy was necessary.
So I did meet Cathy on the day of her biopsy, and I did invite her to see me again a couple of days later when I had the results. So I did meet her in my office to talk to her about the results of the biopsy. And I mean, of course, at this point in time, she was already very concerned and very worried, and probably already expecting that it's not a benign finding. When I then did tell her that indeed she did have cancer, she was shocked, she was scared.
One of the things that I do remember Heidi doing in that meeting is putting the picture of my lungs up on her screen and showing me what the scan showed in each lung, and each lung looked different to me, and she showed me what would not have shown in a chest x-ray, which is the only other thing I might have had at the time. And so it was pretty interesting to see your lungs, to have that as a base point, to have a visual picture of what they were going to have to work on, if you like, and to know that that wouldn't have been found if it hadn't been for the scan. They read the biopsy very quickly also and gave me the results and said that it was cancer. And the day I was told that it was cancer was a Friday. Heidi Roberts, the radiologist whose study it is, told me that. She couldn't have done it in a nicer, more sensitive way. And in the same meeting told me that I had an appointment with Frances Shepard on Monday morning.
Dr. Frances Shepard is a senior staff physician at Princess Margaret Hospital. Her major area of research is in the field of clinical trials for lung cancer.
Cathy Kernahan was a participant in our early detection or screening program for lung cancer. Until recently, the only tool that we have had at hand to detect lung cancer was a chest x-ray. And sadly, by the time lung cancer shows on a chest x-ray, it is often at a very advanced stage and therefore an incurable stage. We now have a technique called CT scanning that allows us to detect tumors that are less than a centimeter in size. And some of the earliest studies suggest that patients found with very early small lung cancers are almost all cured by their surgery.
On the Monday I went to a meeting with Frances Shepard, and I took a friend with me who is in the medical field, and so I didn't have to remember everything. And this friend by that time had done a whole lot of research and had some good questions to ask and a better memory than I had of the meeting. But again, my experience was Frances Shepard was absolutely lovely with me. She was completely thorough, talked about every possible detail, even though I didn't remember it all.
Cathy Kernahan participated in our trial of CT screening, and we identified a small early lesion on the CT scan. This was biopsied and unfortunately was found to be a lung cancer, and Cathy was referred to me at that point. I felt that the best chance for cure for her would be surgery rather than chemotherapy, and so we referred her to our surgical group, and indeed she underwent surgical resection of her cancer.
When we do find cancers, like in Cathy's situation, that are very small, the surgeons don't have to take the lung out anymore, maybe just the lobe of the lung, or in Cathy's situation, even less than one lobe of the lung. So it's just a cancer and then a little bit of the surrounding normal lung to be on the safe side. That was taken out. It is almost a minor surgery. Almost all of the people who participated in the study and the cancer was found in that study were home just a couple of days after the surgery. So I think in Cathy's case it was about 4 days after her surgery she went home. She was discharged.